Hello, my name is Suzanne Dickinson, and I am an instructor here for the EVMS Ultrasound program. Today we're going to be looking at the bladder, evaluating the bladder, and learning how to calculate the volume of the bladder. Okay, so covering our ultrasound objectives for today, we will introduce a clinical application to as it relates to your point of care ultrasound. We'll go over the machine setup and options. We'll go over patient setup and the acoustic window that you'll be using to image the bladder, and techniques on how to acquire your images, and some pitfalls and pearls, and finally some SPI snapshots. The scanning cards you'll be able to see loaded into Blackboard. So for a clinical application, the purpose of evaluating the bladder would be if you are concerned for urinary obstruction, and while you're scanning through the bladder, you're looking for things like bladder debris and shadowing stones. And remember, debris will often be either floating, fine echoes floating in the bladder, or layering on the posterior wall. So for this scan, you'll need to consider certain things about the bladder and how to calculate bladder volume. So let's consider that the bladder should appear as an anechoic structure because it's filled with fluid. And as you know, ultrasound displays fluid as black or anechoic on your screen. It will be enclosed by about a 4 to 6 millimeter wall. And again, be sure if you're going to be evaluating all the way through the bladder, scanning in both planes, that you look for any potential floating echoes that are distinguishable from just the artifact echoes that you sometimes get in the bladder. Look for any hyperechoic shadowing stones. And volume is a calculation of length times width times height times a constant of 0.523. Fortunately for you, the machine will calculate once you've entered those measurements into the package, and I'll show you how that's done as well. For our machine setup, you want to enter the information as instructed by the bladder. I'm going to move back to the machine so I can point out some of these selections you'll have to make. So for your preset selection, you'll have to press the exam button, and if you look up on your screen, you'll get a list of presets, and you want abdomen. You want to press the set button to select it. For your probe selection, you want to be selecting the curvilinear probe. This will be, the best images are from this probe. And for your depth and gain, looking at the machine again, here is your depth buttons. Here are your depth buttons. Here is your gain button. And on the mind ray, your focus position is going to be controlled by the buttons up at the top here. Now, before you begin your exam, you'll want to just leave these in their default position, because all of these will be preset to what the abdomen depth should be anyway, but you'll have to make adjustments to that once you start. Now remember that we have the time gain compensation. Now you want to just keep those central on their slides before you begin to scan. Okay, so let's talk about the patient position. If we move over here to our patient, you'll see that she is lying down in a supine position. And so that's the position that you'll want your patient in normally. Only if you're in some sort of situation where the patient is unable to lie down flat, you'll just have to make adjustments to accommodate the patient. But otherwise, you just want them supine. If we move back to our probe, let's remember that we have the probe marker up here. And so in long axis, you want that probe marker pointing towards your patient's head. And we do a 90-degree turn in transverse axis, where we point to the patient's right, and that's going to be your transverse images that you'll acquire. The probe movements are going to be heel-toe, just like we have done in the previous ultrasound sessions, and sweep, and pivot. Our acoustic windows, if we move back to our patient, are going to be midline. So if I place my probe right onto the patient, right under the umbilicus, this is where I'm going to start. Now remember, the umbilicus is going to be at about L4, L5, but the pelvic brim is going to be down by the pelvic bone. And I'm going to demonstrate that in a moment, or show you that on a pelvis. But first let me show you on the actual patient. I'm actually sliding down in order to get right up against the pelvic bone, and then I'm going to toe the probe so that I can look down into the pelvic, true pelvis, and be able to visualize the bladder. Well, let me show you that on a bony structure of a skeleton so that you have a better visual. If you recall, the true pelvis lies below the pelvic brim. We have the iliopectineal line, and then of course we have the sacrum to the back, pubic symphysis, and pubic bones to the front. And this creates a line, and down inside is our true pelvis, where our bladder and our reproductive organs live. When we put the probe up near the umbilicus, we're more aligned with the false pelvis, which is defined by the ala of the ilium. And your umbilicus is going to be about at the level of L4, L5. So when we place the probe, you have to consider too, there's a lot of overlying soft tissue that you have to press down against, right? So when we're starting just underneath the umbilicus, we slide down to the pubic symphysis. And then we toe the probe so that we can look straight down in to the true pelvis. And same when we turn the probe in transverse, we put it right up against the pubic symphysis, and then we aim that probe towards the contents of the true pelvis. Now, the caveat to this is understand that the bladder can be really quite full, and while we may be putting the bladder, towing the bladder to aim down into the pelvic brim, you may not have to tow as much as you think if the bladder is very, very full. So let's start doing some image acquisition so you can see how I control the knobs. Now I'm going to get a little bit of gel. We already have our preset in place. And I'm going to move all the way down. Now our patient is very thin, and you can already see that we have far too much depth on this image. And so the first thing I'm going to do is adjust my depth. So here's our bladder, but look at all of this space down here that we don't really need. We do want to set the depth so that we include the entire back wall of the bladder, or posterior wall of the bladder. So our depth might be better off just about 8 centimeters. So that's where I'm going to take it. Right about there. You can even do a little less than that on this patient. Okay, then I'm going to make sure that I set my focal zone to the posterior area of interest. So I'm going to move that focal zone. So here's my focal zone. Watch it move more deep in the frame. And I could leave it there. I am at the posterior edge. If I needed to, I could even put it at 6. Either one of those is about right. And as for my gains, you'll note right up here that we're getting a lot of anterior acoustic noise. You can't always get that out of the screen without sacrificing being able to see the wall well, but I might start with my overall gains a touch, and if I think I need to get rid of some more of these anterior gains, that's when I can touch the TGCs anteriorly and try to get rid of some of those. But I already know that that's anterior acoustic noise and that that is not the debris that I was speaking about earlier. At this point in long axis, I've got all my controls the way I want to, and I'm at midline. So now I want to sweep all the way through the bladder in both directions. I'm going to sweep to the right first, and I want to sweep all the way out of this bladder till it disappears. Then I'm going to sweep all the way back through until it disappears. And then I know I've scanned completely through the bladder. Come back to midline, and just as an aside, in case you were wondering, this is the vagina, so I know I'm at a very good depth. And so let me go ahead and turn. And now I can see my bladder in its transverse display. I can still see the walls very well. We still have a little bit of artifactual echoes, but I'm not too worried about those. I could get them completely out with my TGCs, because what I'm looking for are floating debris, layering debris, or any stones that will layer this posterior wall. I want to scan all the way through the bladder in this plane as well. So I'm going to scan all the way superiorly, and notice that I shift to one side to the other so that I get each side as well as I move down. And then I'm going to keep going till I'm all the way out. Now back up to midline and get right to the middle of that bladder. I am going to have to increase my depth slightly here, because notice what's happened when I lightened my touch. I lost my depth here. And as the bladder fills, you will also have to change your depth. So I'm going to increase it once more, and I'm going to move my focal zone up. So it just serves to illustrate that you have to dynamically control all of those buttons that will improve your image. Now I'm going to freeze this image at about midway, and I'm going to show you the dual screen. Sometimes we want to have a dual screen in order to do our calculations. Sometimes the bladder is too full and we can't do it this way. And I'll demonstrate that in this case. If I touch the dual button, you will see that my screen split, and I have one on one side, one on the other. Here's the image I was taking, and the marker indicator is highlighted compared to this one over here. And that means that this screen is active. But I want to get over to this screen. So I just press the dual button a second time, and it switches over to the other screen. Now this one's highlighted. Now when I hit my freeze button to make the screen live again, I can turn to long axis and go right in the middle and freeze the image. Now you could take a volume here, and I will show you it for demonstration purposes, but the truth is you won't get a true volume if you split the screen and it cuts off too much of your bladder, as it does here. In that case, you will have to do this in two separate images. But I want to demonstrate to you how you would do it first in this image, this type of image, and then show it to you how you would do it if you had to do it on two separate images. So if we move to the screen buttons, Here's that dual button that I was pressing. All right, and it's a toggle, so you can go back and forth between the two screens. Now, what I want to do is take a volume here, and here is the measure button. When I press the measure button, if we look up at the screen, you will see that it gives me a volume in the list. You'll also notice that it says 3 distance and as a caret. If I press my set button, which acts like my enter button, it'll give me a list of possibilities. We want it to stay in the default, so we're just going to leave it at the default of 3 distances. So the moment that I selected that, it gave me a caliper, and it also showed me distance with a number here. So this is going to be the first distance. So say I do this long axis image and I place the caliper right up against the wall. I have to hit my set button and go all the way to the other wall. When I hit my set button again, you might be wondering where your caliper is. If you just touch your trackball, it will give you another caliper, and it'll also give you another distance box on your measurement box. So I'm going to do AP, anterior posterior, set, and I'm going to go down to the posterior wall, set again, and it's now giving me my second distance, and once I move the trackball again, it's finally giving me that third distance I need for it to calculate. I'm going to set, go all the way to the other wall, and set, and now you can see that the box has all 3 distances and has calculated the volume for me. If you're ever in a circumstance where you don't have this option, then use that formula that I gave you earlier. Now I want to show you what happens if you have to do this in 2 separate images. So let me take us out of dual by just pressing the B mode button, which is right beside dual, and we'll go back to acquiring an image. I'm going to adjust my depth, and I'm also going to adjust my pressure on the patient. If I press too hard, look how it squeezes the bladder off my screen. If I just loosen my touch a little bit, I can get all the borders of the bladder. I'm going to freeze my image, and this time when I press measure and when I select volume again, it'll still give me that distance down here, that distance box, and I'm going to place 1 set of calipers here. And I'm going to take this image, and remember that is our save button, so I'm going to take this image, and what you may notice is we have our thumbnail over here. But what about the other distances I want? Well, the machine is going to remember that I'm trying to measure some distances. So when I hit the freeze button, I can go ahead and acquire my transverse image, and I'm trying to lighten my touch, and to do that I'm going to have to increase my depth a little bit, and I'm going to freeze this image. Now when I press measure, it's just going to continue on where we left off. See down here? It's going to continue on where we left off. So I'm going to set my AP distance, set, and move my trackball, and there's that third distance. Put that distance in, and now I have my volume, and I will save that image as well. All right, so that is how you acquire volume, and that is how you can use the controls on the machine to help you. So I've already shown you where the dual button is, so just to reiterate, you'll press your dual button and you can toggle in between your screens, And you will also then capture a long axis on one screen, a transverse axis on the other, and then you'll press your measure button and select the volume, and then you will go ahead and get all three measurements, whether you're able to do it on the dual screen or whether you must do it on two separate images. So let's move on from that to talk about a couple of the artifacts you'll see. I already showed you some of the artifacts, and one of the most common ones that we see is that anterior cystic noise. Now you can compensate for that, but you don't want to compensate so much that you can't see the walls of the bladder clearly. One of the other things you may see is posterior acoustic enhancement, which you will see deep to a cystic structure. You can also see edge shadowing. So remember that in a rounded surface, the sound beam can reflect off and you get what's called edge shadowing. And then you can also have reflective shadowing, or sometimes called dirty shadowing, as a result of the air in the bowel that will reflect the sound beam in multiple directions. For our labeling, you want to be sure that when you label this, that you place under the patient's name bladder, and then in the black portion of your image, after you've put the patient's last name and your image is live, you want to put your name and ID and the word bladder on the black part of your screen. However, underneath each of your images, you want to indicate whether it's in long axis or in transverse, because we want you to be able to recognize when you're in either plane. And so in dual screen, you'll have one that under one of those images you'll have long, on the other one transverse, and if you have to separate them, same thing, put long and transverse. And as for the anatomy ID, just refer to your Blackboard instructions as to which anatomy we want you to label in your digital submission, remembering that you can do that on some software at home and you don't have to take up scanning time to get all that anatomy labeling in. All right, some pearls and pitfalls. Don't start scanning until you've selected the preset and entered the patient information. And don't forget to center those TGCs as well. Be sure you set the depth to about 2 to 3 centimeters past the posterior wall of the bladder. And don't forget to set your focal zone at the posterior aspect of the bladder wall, because our area of interest is the bladder here, so that's where you want to set your focal zone. Do set your gains for an anechoic bladder, but don't set it so dark that you compromise the gains of the bladder wall. And don't forget to sweep or fan through the bladder in both planes to find the optimal image in both those planes, as well as to look for any abnormalities in the first place. And do produce 2 separate images for a long and transverse if the bladder is particularly full and takes up your whole image. Now let's move on to some SPI snapshots. So how does that focal zone help to optimize your image? Well, it improves lateral resolution. That's that side-by-side structures. How do we tell that there are 2 structures side by side instead of just one sitting there in the middle? Well, that's a function of the lateral resolution, which is a function of the beam width. The narrower the beam width, the better our lateral resolution. So the typical sound beam is shaped a bit like an hourglass, as you can see in the picture above. But where it's cinched in, that focal zone, is where you have the best lateral resolution. So the application is, place that focal zone at that posterior aspect of the region of interest, because it maximally utilizes the lateral resolving capability of the sound beam, which is a really important component of optimizing your image. In these images here, you'll see that we are imaging the sciatic nerve. Imagine if you're putting a needle in there and you want to put some anesthesia against that nerve without puncturing the nerve. You would have a much easier time of that if you set your focal zone in the correct place as it is in the bottom image, and look how much in clear relief you can see the nerve.